In an age where information is at our fingertips and most people are increasingly dependent on quick fixes and immediate solutions, the practice of self-medication has taken a toll on public health. In Uganda, it is easy to access medicine without prescription. The drive to make money has prompted some health workers to overlook some of the risks involved in this practice.
It is what we call paracetamol. Interestingly, it's a very common drug, very common. It's a commonly used drug, it's a commonly bought drug. I mean, you just walk and buy that medicine. But it is a very, very, very dangerous drug, potentially life-threatening drug.
According to World Health Organization, self-medication can be defined as the use of drugs to treat self-diagnosed disorders or symptoms, or the intermittent or continued use of a prescribed drug for chronic or recurrent disease or symptoms. According to Dr. Juliana Kayaga, a pediatrician at Mildmay Uganda Hospital, some of the dangers of self-medication is delayed diagnosis. However, one is also likely to take the wrong drugs for a given condition. This means that the patient may not know how these drugs are affecting them.
And by the time we eventually find out what the disease is, it's really late and very difficult to manage at that time. Additionally, self-medication can also lead to masking of symptoms, whereby instead of something becoming more obvious, you get some medicine that sort of covers on top, but then allowing that disease to actually keep growing inside.
With self-medication, health workers say patients usually take the wrong doses or may fail to complete a dose, leading to more health risks.
If you do not complete the course of drug, it means that not all of the infectious agent in the body for which the drug is intended to treat will be eliminated or will be completely wiped out in the body. Bits of it could stay.
You're going to only have teased out the microorganisms or the bacteria for this case, and eventually what will happen is, because you triggered them, you will actually subject that particular pathogen or that particular bacteria to resistance.
Commonly abused drugs include pain relievers and antibiotics, especially for flu and cough.
Whereas most coughs and flus are actually caused by viral infections and don't need antibiotics. Antibiotics are very rampantly used. Of course, most of these drugs have side effects. Each drug has its own individual side effects. But the biggest effect that we would see an impact would be having antimicrobial resistance, whereby now the bugs or the bacteria in our environment no longer respond to the drugs that we have because they are used all the time and they are misused.
Dr. Kayaga says they are seeing an increase in the number of patients who require strong medications after taking antibiotics without prescription.
The infectious agents which we treat are increasingly resistant to the medicines that are available today, and that comes from misuse of medication. Primarily it comes from misuse of medication.
As a society, if we run out of drugs to be able to treat people, it would mean that in the future we may not have medicines to treat, and therefore increase the chances of death from infections. But also the medicines become more and more expensive.
Where a person takes medicine without regard of the due conditions under which they should be able to keep the medicine, take the medicine, and to what length they should be able to take the medicine, and for what purpose they should be able to take this medicine.
Health experts say one size does not fit all when it comes to health care, and laboratory tests are necessary to determine an illness, as different illnesses may have similar symptoms.
Sometimes you either having throat pain, you think it is, something that needs amoxicillin. It could be a viral infection which needs a different form of treatment. So the laboratory is able to identify the microorganism or the germ specifically, and then also the laboratory has the potential, the laboratory has the potential of testing this microbe or the germ to different sets of drugs, wide sets of drugs, and then the laboratory will be able to actually identify that this particular drug is the one that is able to treat.
While innovative test kits exist, offering convenience and initial screening, they should never supplement professional medical assessment. After conducting self-tests, it remains crucial to seek expert medical attention.
These rapid kits are good for screening, but remember, medical knowledge is something that takes doctors 7 years, 5 years, and then 7 years of internship. So it is not as simple as that. Yes, it helps in screening for you to eventually go for medical attention. When you get the right treatment, then you get quick healing. But if you are picking a drug without laboratory assessment, it means that you may pick a wrong drug, which will not cause quick healing.
Health workers say there is a need to regulate outlets as well as medicine sold over the counter, along heightened public awareness campaigns to curb the practice of self-medication. Nobat Atkunda, NTV News.